Hello students, today we are going to discuss about male reproductive system. In this video, we are going to learn epididymis, covering of testis, macroscopic and microscopic structure of testis, blood supply, lymphatic drainage, and nerve supply of testis. First, we are going to discuss about the epididymis. The epididymis, it is a comma-shaped structure which is situated on the lateral part of posterior border of testis. Here we can see that a large structure, it is called as testis, on the lateral part of posterior border contain a comma shaped structure, it is called as the epididymis. The epididymis has three parts. First one, it is the head and large body, and body continuous as vas deferens. That portion is called as the tail of epididymis. It have three parts: head, body, and tail. Then first we discuss about the head. It is formed by numerous coils of efferent ductules, which arises from the testis. It arises from the testis. So that portion is called as the efferent ductules. They are numerous in number, which is arranged to form the head of epididymis. That coiled masses are conical in shape, and that forms the lobules of epididymis. This portion is called as the lobules of epididymis. Then the body and tail. And the body, these numerous efferent ductules are rejoined or joined to form a single duct-like structure. That duct-like structure, it is called as the canal of epididymis. That canal of epididymis continues as vas deferens. So that portion is called as the tail of epididymis. So this portion, it is called as the head of epididymis. That means it contains numerous efferent ductules. That efferent ductules joins to form the body of epididymis. Then the body of epididymis, it is continuous as vas deferens. That portion is called as the tail of epididymis. Then another topic, it is the covering of testis. The testis, which contain three coverings, they are the intrinsic covering and extrinsic covering is there. Then first we are discussing about the intrinsic covering of testis. It's mainly covered by three layers. It is called as the tunica vaginalis, tunica albuginea, and tunica vasculosa layers. They are the three layers. It's called as the tunica vaginalis, tunica albuginea, and tunica vasculosa layer. First we are discussing about the tunica vaginalis layer. It is covered the testis and epididymis, some part of the epididymis here, and except the posterior border. Here this portion is called as the posterior border of testis. This portion is not covered with the tunica vaginalis. The vaginal layer, which is continuous with the parietal layer. Here we can see this vaginal layer, and it is continuous as the parietal layer, or the visceral layer, which is continuous as the parietal layer of the tunica vaginalis. Then that forms a closed sac. So that sac, it is called as the closed vaginal sac. And actually it is developed from the distal part of processus vaginalis of peritoneum. Then another layer, it is called as the tunica albuginea. The tunica albuginea, it is a thick fibrous membrane which invests entire testis. Then here we can see that's the tunica albuginea layer, this gray colored structure, colored area. It is called as the tunica albuginea layer. Then it projects into the interior of the organ that forms the posterior border as an incomplete vertical portion, that it is known as the mediastinum testis. This portion is called as the mediastinum testis. From the cortex, anterior surface of the mediastinum, that arises numerous fibrous septa that radiates and divide the testis into numerous conical compartments. Here we can see the conical compartments. It is formed by the prolongation which arises from this layer. That means the tunica albuginea layer. Then they have numerous conical lobules are there. So that is called as the lobules of testis. It is around, or it is about 200 to 300 lobules which is present each testis. On each testis, which contain around 200 to 300 lobules. Then here we can say that the numerous compartment like structure, it arises from the retro testis. That means the organ which is divided by this tunica albuginea layer, and that anterior portion which is divided into numerous compartment by radiating septa. Then this septa, it is around 200 to 300 in number. Then another layer, it is called as the tunica vasculosa layer. It is an areolar vascular membrane which lined in the individual lobules of testis. Here we can see that in this red colored structure which is present inside that lobules. That means it is the lobules which is lined by the tunica vasculosa layer. That gives nourishment to this particular region. Then extrinsic covering of the testis, we already mentioned that the extrinsic covering is there, the intrinsic covering and extrinsic covering. The intrinsic covering, we already mentioned that they are the three layers is there, tunica vasculosa, tunica albuginea and tunica vaginalis layer. There are the three layers. Then we are going with the extrinsic layer of the testis. Here we can see that skin, dartos muscle, external spermatic fascia, then cremasteric muscles, internal spermatic fascia, and three layers of tunics. Here we can say that externally, most externally, we can see that here we can see that the external outermost covering, it is called as a skin. Then just inside that skin we can see that the muscular layer, it is called as a dartos muscle. Then just inside the dartos muscle, another layer, it is called as the external spermatic fascia. Inside that spermatic fascia, the cremasteric muscles is there, cremasteric muscles. Inside that, the internal spermatic fascia. Then most internally, we already mentioned that the intrinsic coverings of testis. Okay, that's the extrinsic covering of testis. Then we are going with the macroscopic structure of testis. Each lobules of testis which contain 1 to 3 seminiferous tubules. We already mentioned that there are numerous lobules is there. Inside that lobules, it contain around 1 to 3 seminiferous tubules on interstitial cells of lining. That's it's a packed cells which is present inside that or around in between this seminiferous tubules. The seminiferous tubules which consist of convoluted part in front and straight part behind. So this portion, anteriorly there we can see numerous convolution, and towards the end when they are exiting that portion, it is straight part. When it is uncoils, which is about length of 2 feet. Then the total number of lobules which present in each testis is around 400 to 600 number. The straight part of seminiferous tubules which ascends in mediastinum testis. Here we can say the mediastinum testis. This portion, we already mentioned that the anterior portion is more convoluted, and towards the medial portion which is become straight. That straight portion which is enters into the mediastinum testis, and it joins the adjoining tubules and forms the plexiform networks. Then tubules known as the retrotestis. This portion, it is called as the retrotestis. That means which is enters into the mediastinum testis, then become that network is there. So that forms a network. That region, it is called as the retrotestis. Then it's about 12 to 20 efferent ductules that arises from the upper end of retrotestis. From here, it is enters to the head of epididymis. That means the head of epididymis which contain around 12 to 20 number of efferent ductules. Each ductule that forms cone-shaped conical masses, that it is called as the lobule of epididymis. We already mentioned that. Then when it is uncoils, the ductules, it is around 6 to 8 inches. Then the efferent ductules unite to form a single duct. This portion, it is called as that contained in the body of epididymis. That portion, it is called as the canal of epididymis, which by convolutions forms body and tail of epididymis. When it is uncoils, with a length of 20 feet, that means 6 meter long structure. When this convoluted portion of the convoluted portion or the canal of epididymis, which when it is uncoils, it is around 20 feet long. Then we are going with the microscopic structure of testis. Each seminiferous tubules which is covered by basement membrane which supporting cells as a generation of seminiferous spermatogenic cells and supporting cells of Sertoli. There's a specialized cell. It is called as the Sertoli cells. Then the sex cells are arranged into three ill-defined zone: outer, intermediate, and inner zone, like that. Here we can see that the numerous spermatids are there. That means the primary sex cells, and when it is become matured, so that is called as the spermatids. Then the finally fully matured cell, it is called this region, so that is called as the spermatozoa. So then we already mentioned that it is divided into three zones. The outermost zone, or the outer zone, which consists of populations of spermatogonia which are direct descendants to primitive male sex cells or gonocytes. So that means here we can see that the male primary or primitive sex cells. Then the spermatogonia, which contain diploid chromosomes. You already know that the diploid and haploid chromosome number, right? Then then we are going with the intermediate zone, which consists of outer layer of the primary spermatocytes. Here we can see that the outer layer of primary spermatocytes and inner layer of secondary spermatocytes. Here you can see the inner layer of secondary spermatocytes. The primary are daughter cells of secondary. The primary cells are daughter cells of the secondary spermatocytes. Then the inner zone, which consists of two or more row of spermatids, two or more layer of spermatids is there. Some residual bodies between them. In between that, some residual bodies are there. The spermatids are daughter cells of secondary spermatocytes. Then we are going with the arterial supply. Mostly it is supplied by the testicular artery. Here we can see the testicular arteries is there. It's mostly supplied by the testicular artery. Partially it is supplied by the vas deferens, the artery of vas deferens. Here we can see the vas deferens. So it is partially supplied by the vas deferens arteries. It is a branch of the superior and inferior vesical artery. Then sometimes it is supplied by the cremasteric artery, which is a branch of inferior epigastric artery. The arteries are longitudinal and anastomosed with one another. Here we can see the cremasteric arteries. These are the arteries. Then venous drainage, about 15 to 20 veins appears from the posterior border of testis and epididymis. They unite to form papiniform plexus, which produces the bulk of spermatic cord. Here we can see the papiniform plexus. There are 15 to 20 in number. Then at the superficial inguinal ring, here we can see the superficial inguinal ring. Then that is united to form only 4 veins. This 20 veins, 15 to 20 veins, it is united to form only 4 veins. Then at the deep inguinal ring, it forms only 2 veins. And finally, it again united to form a single vein, which is found posterior abdominal wall. Here we can see that, the posterior abdominal wall. Okay. Then the lymphatic drainage, it is drains into the pre-aortic and para-aortic lymph nodes. Pre-aortic and para-aortic lymph nodes are following the course of the testicular blood vessels. That's the lymphatic drainage of testis. Then the nerve supply, the sympathetic nerve, which is from the renal and aortic plexus, and the preganglionic fibers, which is arises from T10 or thoracic 10 to and thoracic 11 spinal nerves. So that's all about the nerve supply, lymphatic drainage, blood supply, coverings, microscopic and macroscopic, and epididymis. Thank you.